Hey everyone, it's really good to see you today, and I hope you're doing okay. So, something pretty important just happened in the world of Social Security and disability benefits, and a lot of people haven't fully heard the whole story yet. The Trump administration just walked away from a major plan that could have changed how older workers qualify for disability benefits. And the impact would have been huge, like life-changing for hundreds of thousands of people. And the surprising part is why it was dropped and what it means going forward. There's actually a twist in all of this that most folks don't know about, and we'll get to that a little later. So stick around because understanding this stuff can really help you protect yourself and the people you care about. Before we really get moving, let me ask you something simple. Do you think disability benefits should take into account or not? Just your personal opinion. No right or wrong answer. Share them in the comments. I'd really love to see where everyone stands. So, let's talk about what happened. And, okay, this really started as something that didn't get a lot of attention at first. Behind the scenes, the Social Security Administration was working on this new rule that, honestly, would have rewritten the way disability claims are judged. And I mean rewritten in a way that would hit older workers especially hard. The plan was to remove or sharply reduce the role of age when deciding if you qualify for SSDI or SSI. If you've ever heard someone say, hey, once you hit 50 or 55, it's harder to switch careers or retrain, that's exactly the part they were looking to take out. Now, the reason age has always mattered is because the Social Security system recognizes something most of us already know from real life. When you're older, especially if you've spent your life doing physical work like construction, manufacturing, caregiving, or mining, and then your body gives out, switching to a new type of job isn't easy. It's not just about learning something new, it's about whether your body and mind can actually keep up with it. So, for decades, age has been part of the equation, and removing that would have changed everything. And here's where it gets a little wild. This wasn't the first time the idea came up. This kind of plan had been floating around since Trump's earlier presidency, and people inside the government kept revisiting it. The argument from the administration was, we need to modernize the system, make it more efficient, and update all the job data we use. And honestly, part of that is true. The job listings Social Security uses really are outdated. Some of them still include old jobs like nut sorter or telephone quotation clerk. Like those jobs literally do not exist anymore. The government spent about $350 million trying to modernize this data with the Bureau of Labor Statistics. So on paper, updating things doesn't sound bad. But here's where the tension started. Officials, including people like Russell Vought, who was running the Office of Management and Budget, argued that people are living longer now, work is less physical, and older folks could shift into more sedentary roles. Think stuff like office work, customer service, or even gig economy jobs like driving for Uber or delivering for DoorDash. And sure, maybe that works for a small group. But for most people dealing with disabilities, chronic pain, heart issues, nerve damage, or mobility challenges, that's just not realistic. You see, a lot of Americans don't have access to those options, especially if they live in rural areas or they don't have a reliable car. So then when word started getting out around October 2025, people responded fast, and it was emotional. Disability advocates were furious. Lawmakers were shocked. Regular folks felt blindsided. More than 160 Democratic members of Congress even sent a letter begging Social Security to stop the plan. Analysts ran the numbers, and the estimates were rough. Nearly 750,000 people could lose disability benefits over the next 10 years. And around 80,000 widows, widowers, and children could lose benefits tied to someone else's work history. That's not a small tweak to the system. That's people losing rent, losing medication coverage, losing Medicare access before age 65. The Urban Institute said older workers could see their eligibility drop by as much as 30%. Imagine almost a third of people being told, no, you don't qualify anymore. And the thing is, disability benefits aren't some random payout. They're tied to your work history, your health, your life. For so many people, SSDI is the only thing keeping them afloat. Some even came out saying this is a lifeline for older Americans, and that messing with it could take away independence and stability for people who really need it. And a lot of people in Congress agreed. Now, here's where things turn. And this part really surprised people, even folks inside the disability groups who've been fighting this. Right around mid-November, there was this meeting at the White House. A disability attorney named Jason Turkish and a group of advocates sat down with senior staff. They brought real stories with them, including one about a former coal miner named Christopher Tyner, who lost his leg in a work accident and was at risk of losing his benefits under the new rule. And something happened in that room that nobody expected. In the middle of the meeting, Russell Vought, who had been one of the main people pushing this change, just straight up said, "This isn't going to be happening." Like, he reversed himself right there. According to people who were in the room, it was almost shocking. And one of the White House staffers had been reading Tyner's story earlier, and it hit them how serious the human cost would be. That moment, that single story, honestly changed the direction of the entire policy. After that meeting, the Social Security Commissioner, Frank Bisignano, quietly confirmed that the rule was not going forward. He told advocates that the White House and the Social Security Administration were completely aligned and that the plan was being abandoned. Now there's no big press conference, no official announcement, nothing like that. Technically, the rule is still listed in the Federal Register with a scheduled publication date, but multiple people inside and outside the agency confirm that it's basically dead. So, then, what does this mean for you? Well, for one, older workers who are disabled won't suddenly be re-evaluated under tougher standards. That fear of waking up one day and finding out the rules changed underneath your feet, that's off the table for now. And losing SSDI doesn't just mean losing monthly income. It means losing early Medicare access. And that part is huge. For a lot of people, their disability Medicare coverage is what lets them get critical surgeries or medications they couldn't otherwise afford. Without it, they'd have to start drawing early retirement just to afford medical care. And that early retirement would permanently reduce their Social Security payments for the rest of their life. Another thing to think about is that the regions that would have been hit the hardest are places like West Virginia, Kentucky, Mississippi, Arkansas, rural areas where heavy physical work is common and health problems hit earlier. And ironically, those areas include a lot of Trump supporters, people who truly rely on these benefits to make it through each month. Internal polling from a Trump-aligned group showed that those very voters would have strongly opposed this rule. So walking away from it actually avoids alienating a big part of the president's base. Now, let's talk about the future because I know a lot of you are wondering what happens next. The Social Security Administration still wants to modernize its job database, which is honestly needed. They've spent years and millions of dollars building a new system, and both parties support updating the job listings. But disability advocates want to make sure age stays part of how claims are judged because without it, people in their 50s and early 60s could be treated the same as someone in their 20s, and that just doesn't match real life. You know, your body changes, your energy changes. The idea that someone who spent 35 years lifting heavy equipment can suddenly pivot to a desk job overnight, it just doesn't work. Commissioner Bisignano has also been talking about reducing backlog times. As of late 2025, almost 867,000 disability claims were still pending, and people were waiting over 200 days on average just to get an answer. That's like more than half a year living in limbo. So the agency wants to focus on improving that instead of restricting access. What's more, advocates are saying, this moment shows how important it is to pay attention to the stories behind these policies. One story in the right room actually stopped something that could have affected hundreds of thousands of lives. And that's kind of a reminder that disability and Social Security in general isn't partisan. It's one of the few programs that really touches everyone. And sometimes empathy really can steer policy. So then, where does this leave us? Right now, the rule is gone. People keep their protections based on age, and disability advocates feel relieved but cautious. SSA is still planning to update old job data, but they're trying to do it in a way that doesn't hurt people. And there's talk that Commissioner Bisignano may do a public town hall to help rebuild trust with the disability community. That could be a good step toward transparency. This whole situation kind of shows how fragile things can be. It reminds us that understanding the system helps you defend yourself when changes come up. And honestly, it shows that people speaking up matters. This decision wasn't reversed quietly because someone flipped a switch. It was reversed because regular people, lawmakers, disability attorneys, advocates, and everyday Americans raised their voices. The system heard them. If this helped you understand the issue a little more clearly, take a moment to hit the like button and subscribe. It really keeps this thoughtful community going. And feel free to share this with someone who might need to hear it today. Thanks for being here. Take care of yourself, and I'll see you soon.